Hello, guys. Good evening. Welcome once again to my YouTube channel. Earlier on, we had discussed about pneumonia, and we are going to finalize it by discussing about signs and symptoms of pneumonia, how to make diagnosis of pneumonia, and finally, how to treat pneumonia or how to manage it. Now, we had said pneumonia is it is the inflammation of the lung parenchyma caused by the various microorganisms, including bacteria, viruses, and fungi. Now, the signs and symptoms of pneumonia include shortness of breath. They have the chest pain. We have a productive cough. Is it a productive or non-productive cough? We have fevers or chills. Then we have general body weakness or general body pain. So those are the signs and symptoms of pneumonia. Now, so when a patient comes with the signs and symptoms of pneumonia that we have mentioned, um, I know your impression maybe will be upper respiratory tract infection or a pneumonia. So, how do you make diagnosis of pneumonia? So, making diagnosis of pneumonia include your examination, doing an examination on uh, on your chest, and uh, by also doing blood works including full blood count, and we have ESR. Then we have also chest X-ray. So those are the things actually that will help you to make diagnosis of pneumonia. Now, in your examination, a doctor will check on your chest or will listen to the sounds with the sounds that are normally produced by the lungs during inhalation and exhalation. So they are the normal sounds that a normal person, that is a healthy person now, produces. So after listening to your chest, a patient with pneumonia will actually have sounds like fine crepitation, coarse crepitations. So those are the common sounds that are actually elicited by doing auscultation of the chest. And number two is doing a chest X-ray. So when you do a chest X-ray will show the lung fields. If a patient is having a lobar pneumonia, you will actually see it in the chest X-ray. Um, Number three is by doing other investigation like the ESR. ESR is the erythrocyte sedimentation rate. For the normal patient, or the normal range for the ESR is between 0 to 20. So a patient with now a bacterial infection or any infection in the body, the ESR will be actually quite elevated, and those are the lab investigations that will help you in making diagnosis of pneumonia. Though elevation of the ESR can indicate that there is something else in the body, but it is something which is actually helpful when you're making the diagnosis of pneumonia. Now, let's discuss about the treatment of pneumonia. So the treatment of pneumonia actually depend with the with the patient state. Not the patients will not present the same. Some will actually present with the mild symptoms, and some will actually present with the severe symptoms like now shortness of breath, or they are not able to breathe well. And those are the patients actually which might even require oxygen. So the management of pneumonia actually depend on the states of the patient. Like now, a patient has come with just a mild chest pain and a cough, either productive or non-productive. And after doing the examination of the chest, and maybe you hear there are some coarse crepitation or fine crepitation, or even sometimes associated with the wrong guy or wheezes. And so in your management, if the patient is not having difficulty in breathing, you can manage that patient by use of just the simple antibiotics, the oral antibiotics, or you can add some bronchodilators. Bronchodilators are medication that help your patient, can help you to dilate or make your airways uh, clear so that you can breathe well. So the other thing is oxygen. That is oxygen, and that is supportive management for the patients actually who are having difficulty in breathing. So you administer oxygen, and for those patients actually who are having low saturation of oxygen, you put them on oxygen as you treat them, and as you also give a bronchodilator that will ease the chest, and maybe after 24 hours or after some few hours they'll be able to breathe on their own. And so management number 3 or number 4 is pain management. Most of the patient actually will come with a chest pain. So you are supposed to add some analgesic or painkillers in your management. At least they'll feel comfortable during the treatment. Now, the administration of antibiotics, we have first line antibiotics, and then we have second line. So for the first line antibiotics, when you administer first line antibiotics, and then after maybe 5 days, and the patient are not able to respond, you can actually stop the first line and you can use the second line. Second line antibiotics, there are some second line antibiotics which are actually oral medication. The patient can continue taking it at home orally, and some second-line antibiotic you can administer through the vein. So you can either choose to admit the patient, now depending on their state. Maybe they are having difficulty in breathing. So if a patient is having difficulty in breathing, you just admit the patient, put them on oxygen, then you now administer the second line antibiotic if the first line antibiotics have failed. And so that's how to manage pneumonia. So we'll discuss with other things in the next episode. Thank you.